Up next is a conversation between Lydia Ramsey, senior reporter from Business Insider, and president and CEO of Ancestry, Margo Georgiadis.
We are family. I got all my sisters with me. We are family. Get up, everybody, and sing. We are family.
Just playing musical chairs up here. Don't mind us.
We're all family, right? Why not?
So Margo, thinking back on your career, did you ever think you'd be here sitting at a healthcare conference talking about Ancestry?
Actually, it's not as big of an impossibility. My mother actually dedicated her life to public service, and she was in the healthcare industry for over 40 years. So I grew up hearing about everything to do with the healthcare ecosystem. She was in policy. She was actually one of the early advocates for PKU testing, and actually passed that original policy in the state of Illinois. So actually this is kind of, I think it's kind of was always in me.
Yeah. That's fun. So you've been in Ancestry now a little bit over a year, correct?
Almost 2 years,
Okay.
yeah.
That's exciting. And it seems like you've been busy, like especially this past fall. So one of the big questions that I always had coming into this conversation was, why health? Why is now the year for you to launch into the world of health reports?
Absolutely. We, as the leader in consumer genomics, this is something we've thought about for many years. And the time really was now for us to pursue this for 3 reasons. The consumer's ready, the science is ready, and the technology is ready. And that, for us, really pushed us over the edge. Because as a company that focuses on missions, the mission-driven, we empower journeys of personal discovery to enrich lives, we wanted consumers to be really excited about this journey, and we talk to our consumers all the time about what they really want from us. And over 83% of our consumers in a recent survey said they really wanted to know more actionable information about their health, and they saw genetics as a really important component of that. And obviously that connection back to family history. The second piece is we now have so many more actionable DNA differences that science has actually proven to be clinically actionable. So we can actually take people to that next step. And technology for us, it was really important to get to next generation sequencing and be able to provide that to millions of people at an affordable price.
Yeah, and I want to get kind of nerdy on this for a little bit. Let's talk about the design of these tests. When you came out with these, like just a couple weeks ago, these are doctor-ordered tests, which is kind of interesting and probably a lot different than the traditional kind of paradigm of the Ancestry part of the test. How did you kind of design it? Like, what kind of went into that process, and how did you kind of think about this is the right way for us to do it?
Absolutely. Well, as with everything we do, we start with the consumer. And the consumer was really clear what they wanted. They wanted to focus on things that were actionable, because they wanted to really take their family and themselves on a journey to improve their health. The second thing consumers really talked to us about was genetics is new. I was just in a session earlier today where several people shared that over 54% of people don't even really know what genomics is. And so we have a really important responsibility with over 50 million people in our network to make sure we provide genetic counseling and other support services to people who go on this journey. And the third thing they cared about was, I want to seamlessly be able to hand off with my doctor. It's really important that I can take that, and I want the most comprehensive screening available. And that's really what we've provided in the solutions that we've offered. They're curated. We provide a really supportive step-by-step counseling access. You can take physician-friendly reports in, and they have the medically recommended guidelines. So no matter what the background of your physician, they would have that supportive service. And in addition to that, we offer the next generation sequencing. So we're just really excited to bring this solution to consumers and really respond to what they cared about most.
Yeah, that's interesting. How did you kind of pick your spots then? I mean, I'm sure there's a million different tests you could offer within the health realm. Like, what kind of guided you? I know there's, vitamin tests, some in the heart kind of health space, obviously things like cancer, genetic risk. Like, what kind of guided you to that stuff versus other reports?
Absolutely. Well, the Ancestry Health Core is based on our genotyping array. It's really a first step to give people a taste of what the experience would be like to go on this journey. And then we really hope as many people as possible will moved to the Ancestry Health Plus, which is next generation sequencing, and through that we can actually explore all the areas that you can think about that are related to your family history and your genetics. So we'll cover all the blood, cancer. We don't really have to choose. We can actually systematically cover all of those things that are actionable for consumers across all those different areas. And so we're really excited to bring the most comprehensive screening service available to consumers today.
Sure. And I guess thinking about this too, you know, your most direct competitor, 23andMe, went through the FDA approval process and kind of, you know, built that pathway essentially. But we haven't seen many other genetic testing companies do that. A lot of them do follow the same thing where they use a doctor on the front end to order the test and go from there. Do you think there's a world in which you'd go and try to get FDA approval, either for a direct-to-consumer route or for the doctor kind of oriented model?
Yes, so at the end of the day, the consumer wants to be able to get to a better health outcome. And we chose the path that we did because by having a doctor-ordered test, it enables us to deliver that physician-friendly report, a report that they're used to seeing, the same lab report, and those medically recommended guidelines for action. And so for us, following that LDT model enabled us to fulfill what consumers really wanted. And for us, it's really important to be both friend of the consumer, but friend of the ecosystem, because consumers have a great health outcome when they collaborate with their doctor on that action plan. And so that commitment to that experience for the doctor has to be as important as it is for the consumer.
That's interesting. So is this like a test that, you know, if I were to go to my doctor anyway, I could say, hey, I want a genetic test and get kind of similar of a panel to what you guys offer, or is it much different?
So today, unless you have concierge medicine access, which is incredibly expensive, you would not be able to have access to this comprehensive of a screening protocol. And so we are excited to be the first to bring the most comprehensive screening protocol across all the main genetic areas. And so this for us is really pushing the boundaries of what's available to every consumer out there. And think about it, for the cost of a cup of coffee a week, you can have this comprehensive genetic screening for both yourself and then understand those important risks for yourself and for your family. And that was something that we really wanted to get to that journey. It's a journey. We're just at the first inning of all the things that we'll discover through genetic insights and a broader screening that we can do to help people in their journey to preventative health.
So no plan to go to the FDA yet?
We can't provide that doctor lab report without a doctor-ordered test, so that's really the best protocol for us to be able to do that.
That's the line. Okay, got it. You know, you launched about like a week or two ago, so it's still pretty new, but I guess I'm curious, like what's the biggest question you get asked about it?
You know, what's been so interesting is as we offered this to consumers, clearly they had indicated enormous interest in this product. And so millions and millions of people have been coming and reading, and we focused first on education, helping people understand what is this journey, what is this service, how could this really add value to your life and your family's life. And so we just had an incredible reception. What I'm really excited about is as many people are taking the Plus as are taking the upgrade to the Core, and that I think just shows how much people are really hungry for this more comprehensive information.
Yeah, that's interesting. I'm sure there's no numbers you can share around that yet. But I know I tried to update and I couldn't do it as a New York resident, and I thought that was really interesting. How are you, like, will there be a way for New Yorkers to get the test in the future?
Yes, we're working on that. There's some very specific things that we're working on in New York to make the test available there.
Yeah, they got those tricky regulations, I know. Yeah, and you've kind of hinted at this a little bit, this idea that, you know, consumers have been asking for this, and you know, it's really interesting for me as a reporter to kind of watch the healthcare ecosystem kind of change and genetic tests become this huge thing that millions, tens of millions of people have used. But it seems like, you know, you heard it in Illumina's call a couple months ago, that there seems to be signs that there's a little bit of softness in the consumer genetic space. How are you kind of thinking about that, and how are you kind of preparing for it? Is health like a big piece of that? How are you thinking about that strategy if, you know, consumers decide that they're not as interested in putting this under the Christmas tree?
So, we've been obviously the best-selling gift at the holidays, since you just mentioned it, for the last 2 years on Amazon. Literally next to the Echo, we were the #1. And I think it's just people have an innate curiosity to understand their family. There isn't really a more personalized gift that you could give to someone that can create a more meaningful conversation in your family. So that innate interest, I don't think, is going to go away. There is no question that all the broader conversation about privacy in the technology industry, I think, has left some consumers on the fence. But it's our job as a category leader and innovator. We've always been a company that's been deeply founded on this partnership with consumers. For 3 decades, tens of millions of consumers have chosen to put their most precious family information and stories and to save that with us and pass that down generations. And so we really think about ourselves as a company that has a privileged relationship, and it's our job to help consumers feel the confidence and provide the product innovation that gets the market to continue to grow.
Sure. And it's interesting that it's Plus, right, that has the subscription model attached to it. How did you guys kind of arrive at that model?
So we look at this just as we made a commitment 30 years ago to help people on journeys of family history discovery. We had just a few records at that time of a few types, right? But now we have over 20 billion records from across the globe in 30,000 record collections, which enables us to help people build the richest, deepest trees possible. You can just imagine that we're just at the first innings between understanding comprehensively your family history and your genetics, and there's so many other things that we can also screen for on this really important journey to empowering consumers with the knowledge that enables them to take action to get to better health outcomes in collaboration with their health provider.
You've been banging this healthcare provider as part of the picture for a little bit. And I think it was really interesting when, talking around the launch, you and I talked a lot about, having something that's actionable and having something that you can do something about and bring to your doctor and kind of, I have the report, now what? That question. I guess from where you sit, like, what other things need to get built out in the ecosystem to make that actually possible? Is that something you alone as Ancestry can do?
Well, we do believe that we have a big responsibility with over 15 million people in our network. Anything we do will affect a lot of consumers as well as providers. And so I'm actually really excited to announce today we are making $1 million grant to UpToDate so that they can independently create resources and education information for healthcare providers on genomic testing, help them interpret and act on the results of genetic testing. And for us, this is something that we really wanted to encourage and accelerate for all health providers in the community. And when we interviewed people across the community, UpToDate was vastly the most popular place that everyone went for their health information. And then for anyone who doesn't use that platform, they'll be able to access information for free on Ancestry. So we really do believe that it's our job as an industry leader to provide access and encourage the development of information that can support the ecosystem.
Sure. Is that enough, though? Do we need other people to step up or other folks to start getting really geeky about their genetics?
So we hope that everyone, will join and support this initiative to help ensure that all physicians have access to this information within their existing workflows. I think it's really important. That's the one thing physicians, have a lot on their plates, and it's our job to really make sure that that last mile connection between the consumer and the physician is as collaborative and supportive as possible. And so that's really a huge mission that we have in creating this service, because that's how we're going to help consumers get to better outcomes.
Yeah, that's really interesting. So, thinking about, I know it's kind of hard to talk about the future when you're probably like, oh, we just got the health thing out the door. But when you think about the future of Ancestry, including health now, what does that look like? Do we always see the consumer genetics world as being, I'm selling you a kit, here's the report, do something with it? Or do you ever see it evolving for Ancestry?
Well, our long-term commitment is helping consumers get on a journey towards improving their health outcomes. And there's so much more to discover, and we hope that just a few years from now, all of us will have access to a personalized plan to improve their health outcomes in collaboration with their doctor. And there's absolutely no reason we can't have that comprehensive data available affordably for absolutely everyone. I mean, there's millions and millions of people that are suffering and needlessly dying of things that if they understood their risks, they could take proactive action to either mitigate or dramatically improve those outcomes. And so that's really our mission, and we want to help as many people as we possibly can. And we're going to invest in the science, we're going to invest in the consumer experiences, the counseling, the support to the ecosystem, all those things that are necessary to make that possible for as many people and to measure it. Because I think that's what will motivate everyone to take action, is when people see real outcomes, they'll be motivated to do more and more. And we've been talking about this at the Whole Health Conference, right? We exist in a world where consumers are having to take more responsibility for their health care, and we need to support them with the tools and the information and the support that they need to get to better outcomes, and we want to be part of that solution.
What's an example of an outcome you're curious to see, if you can hit on?
Oh, absolutely. I mean, so many people are walking around with healthcare risks today that they're not aware of. You know, I think about, I'm in that age group where my kids are growing up and we're all sitting around and we're talking about, you know, our latest diet and exercise routine, or, you know, and somebody's saying, God, I just feel really tired and fatigued. And, you know, they might be just told by their doctor, if they didn't have good genetic information, that, you know, you need to rest, you probably need to go on more vacations, slow down a little bit. But if they have the genetic risk for hemochromatosis, right, that actually has all of those symptoms. And so if that was known, right, there's a very simple, straightforward treatment, which is to give blood. And that's an amazing thing, because otherwise you would have iron buildup and potentially die of cirrhosis of the liver, which is completely avoidable and unnecessary. And we need to be part of ensuring that things like that don't happen.
Sure. Yeah, that's interesting. But one of the things I think about a lot too, you know, in my reporting is thinking about, say I'm feeling tired, maybe it's my genetic risk, maybe it's something entirely different, something about my, you know, everything, there's a million different data points you can turn to. Like any in particular that you're curious to know more about? You know, we've had genetics, there's been a lot of talk about the microbiome, any other kind of data sources you're
There
curious
are a lot of omics,
Yeah.
and I think over time, integrating those all into one place for consumers and helping them understand that, as well as the ecosystem and supporting them to have access to that information affordably. I think that's what we've really done for genetic testing, is use our scale, our supply chain expertise, our consumer focus to create really consumer-friendly solutions and to drive down the cost of access and drive up the quality. And so that's really what we're all about as a company. And I'm just so proud of our team. They're just an amazing group of people that are so passionate about helping people.
Yeah, any omics in particular that you've got your eye closer on than others?
You know, we've been looking at them all. You know, as some of you may be aware, we did one study on longevity, leveraging our family tree network of over 110 million family trees and 13 billion ancestral connections, along with our genomics network. And we actually looked at what are those fundamental drivers of longevity. And what's absolutely true is genes are not your destiny. There's so many other factors that are important to that. And for everyone here, you should know that your spouse, if you haven't read that research, go to Nature, is one of the most important choices that you can make. And there are many others that we, I think, can explore and understand and add in to that exploration and helping consumers live better lives.
That'd be interesting. So kind of switching gears a little bit, but you know, one of the things that I've been thinking about a lot at this conference, and we've been hearing about it, we had David Freiberg on stage yesterday talking about Google Health. Because you have such a deep background in Google, I'm kind of curious, what is your perspective on what big tech is going to do in health?
You know, I think about myself as not so much a technologist, but a humanist. And I think we spend way too much time talking about technology and not nearly enough time talking about people. Because when we're really focused on people and how we solve their problems, I think we get to much better outcomes. And my hope is that that change really starts happening. I think there's more technology, there's all this discussion of AI and machine learning, but really what matters is what problems are we really solving for people on that. I think we've seen some amazing advances in things like radiology and some of those other areas. Ultimately, when you think about aggregating all those omics and being able to be that collaborative partner, there will be tremendous insights from population scale databases. in collaboration with consumers that can enable us to make more discoveries than ever before to save lives. And it's just an exciting time for people who want to take action to better improve their health outcomes. It's just the golden age, I believe. Over the next 10 years, magic will really happen.
Are there going to be any things that kind of catalyze that? I mean, is it already in action, or do you anticipate kind of, because I as a consumer, you know, have taken a couple of these tests, I've been a part of the world, but I don't know if I'd be the most like gung-ho to be all in on every single piece of my health data all the time.
Yeah, I think what this is about is trust. And you know, as a company, I think we believe that for us, the three differentiators are our trusted relationship with consumers for 3 decades. This is a company that's made every decision starting with that consumer first. We have a business model that aligns with consumers. Our subscription focus really has us always having to innovate on behalf of that consumer every month, you know, every year. And that for us drives everything we do. And also our data assets. And I think people have chosen to collaborate with us. A huge proportion of our existing content on Ancestry, in fact, 40% is user-generated. And I think people do trust that we are a place that puts the consumer first. And I think that's trust that's earned over decades of committed work with them. And I do believe if consumers feel that they trust a company, that they will be empowered to go on that journey, but we have to do it with them, with their permission, and we have to prove that that's having impact, that that's real outcomes for them. And I think when we're able to do that, consumers will really be excited to go on those journeys. But we have to focus on people and those outcomes, and it's not about lab reports, it's not about technology, it's about what these things can do to really change lives. And I think that if we all start focusing there, and we focus on the ecosystem, how important is the ecosystem? It's not just what we give to consumers, but it's how they collaborate with the ecosystem. If we focus on people and the ecosystem, I think we'll get to amazing things.
Sure. I know we're very much out of time, but when we're looking back in 5 years, like what's gonna really quickly, what's that impact, that outcome? Like, what are you looking to achieve with these new reports? Like, what would success look like for that?
Absolutely, prevention is possible, and we want millions of people to have personalized plans with their doctors to be able to mitigate or much better manage a whole set of important health risks across all aspects, you know, of their biology, and we're just excited about that.
Well, I'll be looking forward to my health results hitting my inbox sometime soon.
Oh.
Thank you so much, Margo.
Thank you.
All right.